Today, we're going full-on detective. We're on the hunt for clues in one of the most complex medical mysteries out there, amyotrophic lateral sclerosis, or ALS. The challenge? Finding the hidden signals in the body that could finally help us crack the case.
This really gets to the heart of the problem, doesn't it? With ALS, the damage is happening to nerve cells deep inside the body where you just can't see it. So for years, doctors have been stuck looking for the external signs, kind of like seeing smoke or hearing a weird noise from your car. And by then, the damage has already started.
So how do you get ahead of it? If you can't just pop the hood and look at the engine, you need better tools. You need clues. And in medicine, these clues have a name: biomarkers. A biomarker is really just a biological signpost. A great way to think about it is like having a water detector for a hidden leak in your wall. You can't see the leak, but the detector beeps. It's a measurable signal, maybe a protein in your blood or something in a brain scan that tells us, hey, something's going on here. It can signal if a disease is present, how fast it's moving, and even if a treatment is actually working.
And for ALS, finding these signposts is absolutely critical. Right now, getting a diagnosis can take up to 21 months. That's a devastatingly long time to wait for answers. Biomarkers could slash that time, let doctors track the disease, see if a new drug is doing its job, and maybe, just maybe, identify people at risk before they even have a single symptom. For patients, this is a race against the clock.
So where have our scientific detectives found their first major lead in this whole investigation? Well, it all comes down to one key piece of evidence, something called neurofilaments.
Okay, so when nerve cells get damaged by ALS, they basically crumble and release these little proteins called neurofilaments. The analogy here is perfect. If a nerve cell is a piece of wood, neurofilaments are the sawdust you see when that wood gets damaged. So the more damage there is, the more of this sawdust you're going to find floating around in the blood and spinal fluid.
And when you look at the difference, it's just striking. In healthy people, you barely see any neurofilaments, but in people with ALS, the levels are way, way higher. And researchers have found a direct link. The more sawdust you find, the faster the disease seems to be progressing.
Now, this isn't just a theory in a lab. This is already changing lives. In 2023, the FDA actually approved an ALS drug called als.COMMUNITY, and one of the key reasons was because the drug was proven to lower these neurofilament levels. It was a huge moment, really, because it proved that a biomarker could show that a drug was hitting its target and slowing down that nerve damage.
But even a fantastic clue like that rarely solves the whole case by itself. To really understand ALS, scientists realized they needed an entire toolbox of different clues. So the search got bigger. They're looking at things like TDP43, which are these protein clumps found in almost all ALS patients, but they're still pretty hard to measure. Then there's P75ECD, a potential marker found in urine, which is super easy to collect, right? But it needs a lot more testing. And of course, there's imaging, like brain scans, which can literally show us the nerve damage, but that can get expensive, and not everyone has access.
Each of these clues is valuable, for sure. But what if you could combine them? Well, a really recent breakthrough might just change the entire game.
Okay, get ready for this. A new study just came out that identified a whole panel of proteins in the blood that can detect the signs of ALS. But here's the incredible part. It might be able to detect them up to 10 years, a full decade, before the first physical symptoms even show up. Think about that. A 10-year head start. That's a game changer.
And it gets even better. The accuracy of this new test? 98%. 98! Can you imagine? A simple, super accurate blood test that could find people at risk and give them a chance to start treatments that might slow down or maybe one day even prevent the disease from ever taking hold.
So with these mind-blowing discoveries piling up, what does the road ahead actually look like? What do all these clues really mean for patients, both today and tomorrow?
Well, the promise is just enormous. We're talking about tracking the disease, proving drugs work, and diagnosing people so much earlier. But we have to be realistic. There are still some big challenges. For one, many of these markers aren't only found in ALS. Some tests are still expensive or invasive, and all of them need to be standardized before your local doctor can just order one.
Still, you can see the future of ALS care starting to take shape. We're heading toward a world where early detection is a real thing, where treatments are personalized to your specific biology, and where you might even be able to monitor the disease with simple at-home tests.
And the innovation isn't just biological. We're seeing AI get in the game,
helping to predict how a person's disease might progress. We're talking about digital biomarkers from your smartwatch or phone that can track movement and speech. And on top of all that, there are these huge global efforts to share data to make discoveries happen even faster.
You know, what's so powerful about this whole story is that it's not just happening in some isolated lab. This is a search that pretty much anyone can join. It really is a massive team effort. So if you're listening and feeling inspired by this, there are real, concrete things you can do. You can look into joining clinical trials. You can donate samples for research. You can support the foundations that are funding this work, or you can just talk to a neurologist in an ALS clinic about what's going on locally. Every single person who participates provides another piece of the puzzle. This hunt for biomarkers is honestly one of the most exciting detective stories in medicine today. Now, we started out with very few leads, but now, with every single new clue we uncover, from that first sawdust to these incredibly complex protein panels, we are getting so much closer to finally solving the mystery of ALS.
And that leaves us with a really powerful question to chew on. Could a simple blood test one day stop ALS in its tracks? We're not there yet, but for the first time, it doesn't sound like science fiction. With the way this research is exploding, that ultimate goal, a world without ALS, feels more possible than it ever has before.